This is Rick Kaselj from exercisesforinjuries.com. Before I went to the gym today, I put up a message on my Facebook fan page, which just hit 7,000, so thank you very much, if there was any specific videos that people wanted me to do. And there was a couple questions that people asked and they wanted me to do videos on. So for this one, the question ended up being, how do we help clients to squat if they have patellofemoral pain syndrome or lack cartilage in the knee? And this was from Stephanie. So thank you very much, Stephanie, for the question. So there ends up being 4 things that I end up doing with my clients that end up having patellofemoral pain syndrome, or they end up lacking cartilage in that knee joint. And we'll end up using the suspension trainer to go through this. So this ends up being really good because with a suspension trainer, I can kind of offload that knee when it comes to going through the exercise. So the first one is, when it comes to squatting movements, I want a vertical shin. And if I use a suspension trainer, it's easier to get into that vertical shin. So with that vertical shin, it decreases how much bend is within that knee. Now, if Orsi moves her knees forward, you can see her foot stays the same, but now her knee is a lot deeper, in a deeper bend, and with that deeper bend, it puts more stress on the knee. So use a suspension trainer and work on keeping that shin vertical, and that ends up being good for patellofemoral pain syndrome and any type of cartilage issue. Now the second thing is look at a progressive squat. So getting them to start and just progress to the point where they have no pain in the knee and come back up. Coming down to the point before pain and coming back up. And building that depth that they can end up doing. Because as I go deeper, it puts more stress on that patellofemoral joint and also puts more stress within that knee joint. But you want to work the muscles throughout that full range of motion. Because if I keep avoiding those ranges of motion, I end up losing strength in those ranges of motion. And I want to build those strength in those ranges of motion because they decrease the stress on that knee joint and that patellofemoral joint. Perfect. Thanks, Orsi. Now the third thing that I would end up doing is looking at focusing in on hip dominant exercises. And those can end up being like deadlifts or kettlebell swings. And those end up being excellent exercises because you're still loading up that knee and you're isometrically working the muscles around that knee joint. So we are still working that knee joint and we're still strengthening the muscles around the knee joint, which is good. And also with those hip dominant exercises, we're working on strengthening the hip. Now, if you have a weakness or injury or pain in that knee, we want to do everything we can to strengthen up the hips because we're gonna need them to do more work because the knee joint is injured or in pain. Now the fourth point ends up being, and this one's almost always overlooked, is what is your client doing away from the gym or away from the exercises? And what they do outside of the gym will ruin everything that is done within the gym. So if they are putting that knee in high stressful positions, that will just irritate the knee, and it really doesn't matter what you do in the gym because it's not going to help when it comes to the recovery. So your client needs to work on keeping that knee in low stress positions. And low stress position is keeping that leg straight, because sitting at the desk with the knee bent progressively builds up stress within that knee. If they're in a deep knee position, knee bent position, for a long period of time, that puts lots of stress on the knee. If they end up doing lots of kneeling throughout the day, that's going to end up putting the knee within a stressful position. So it's very important if they have knee pain or knee injury that throughout the day they're doing everything they can to put the knee in a low stress position. So there you go. Give those a go with your client. Work on keeping that vertical shin, which is important. Work on the progressive squat. The suspension trainer works excellent for that. Thirdly, look at the hip dominant exercises, because you're still getting benefit from strengthening that knee, but then you're also strengthening a joint that you need help with when it comes to protecting that knee and recovering from that knee injury or pain. And then fourthly, keep that knee in low stress positions throughout the day. So this is Rick Kaselj from exercisesforinjuries.com. Make sure to swing by exercisesforinjuries.com, enter in your injury or pain. There's a good chance that I have a video, article, or interview that'll help you overcome your injury or pain. Secondly, if you're watching this on YouTube, head up above, hit subscribe. What that'll do is every couple days you'll get a video like this where I talk about injury or pain, overcoming injury and pain. Lastly, thirdly, head down below, hit like, leave a question or comment, and I'll get back to you. So this is Rick Kaselj saying take care and goodbye.